Welcome, dear viewers, to our format today, Natural Medicine. And today I have the Chief Physician of the Sonnenberg BioMedicine Center with me, Alexandra Kotthaus. And we'll talk about the topic of depression and fears and how to get out of drivelessness. And how to tune in to people in a holistic way. You'll find out today. Stay tuned. Hello, Alexandra.
Hello.
Nice to have you back.
Thank you.
Fears, drivelessness, depression is really a hot topic at the moment. Unfortunately, also among many young people. I think we currently have the highest suicide rate we've ever had among young people. So it seems to be really hot everywhere.
Yes, unfortunately.
The external circumstances have led many people to fear and depression. Nevertheless, with all the interviews with you, I always see what I've learned there. The connections of the liver, the intestine, simply also the nutrient supply issue. How do you deal with the patient now? What is the most important factor for you right now?
On the one hand, I experience it the same way. Especially in the last 2 years, the topics are back in the foreground, which I haven't experienced so extremely before. And it's certainly a multifactorial event. But I think a stressful situation that affects a person for a long time has the potential to traumatize a person. The word trauma is strictly speaking, psychiatrically, very narrowly defined. And in the scene around it, which somehow has to do with self-experience, it is often laid out a little more generously. I think the truth is somewhere in the middle. And yes, but it's not just that. I think the last 2 years have made it even clearer that there is a certain need, that there is a mental part to it, a stress part to it. And yet, I think, something like that always has to hit a certain fertile ground. The fertile ground doesn't necessarily have to be old loads in the luggage, in the mental luggage. The fertile ground can also be something completely different. And increasingly, and I agree with you, I increasingly see young people with fatigue, with depression, with anxiety disorders.
Compulsive eating.
Yes, compulsions too, with irritation of the involuntary nervous system, where the vagus nerve is the largest part of our parasympathetic nervous system and provides heart, lung, stomach, intestine.
Und versorgt Herz, Lunge, Magen, Darm und
And there is, let's say, when it gets irritated, yes, and then someone has. I just had a series of patients again, they say, I have it so tight here. I have it so tight here. So in the direction of the diaphragm. And then there are heart poundings. And that is even said to them, go to the hospital. They are afraid of getting a heart attack, and that is explained to them as a panic attack. Then one day I really had a patient who had a psychiatric pre-diagnosis, which I also treat psychiatrically, which came then. I have a new kind of panic attacks. Let's see, tell me first. Then she also told me how the chest gets tight here, and I don't even know in detail, a few other things, and then I say, it's not a panic attack. So, excuse me, it's not, oh, then it gets better when I yawn. And when I breathe a little more calmly, it gets better. And I say, yes, in theory it works, but panic attacks, according to experience, it doesn't work with 90% of panic attacks, even if it's a well-intentioned advice from most psychiatrists. And then I said, that sounds like a vagus irritation to me, a nerve blockade, or a vertebral blockade. Then I quickly looked into the calendar, called our therapist and said, Jonathan, can you please come up? I think someone here has a vertebral blockade. And in fact, he then solved the blockade, and whoosh, she felt better. The tight feeling here was gone. So, again, always think in multiple layers. So this panic attack is not exactly a panic attack. And he explained that nicely to the patient. What happened there is that the diaphragm has cramped, the lower chest is pulling together here. Then the heart has no room anymore. Then the heart has to beat faster to compensate for the limited pumping capacity again. Then you felt your heart racing. That triggers a feeling of fear again. I can't breathe, he also described it. He described it to me emotionally neutral. Now, of course, I know a lot of people who have described their panic attacks to me. And I know this patient was already very well. I could just say, the combination, you don't have a panic attack.
Now we're talking about fears. What is there to really consider? There are different forms of fears. Of course, you also have a doctor in psychiatry. If you don't want to solve everything medically right away,
You don't have to. One thing is very roughly different between specific phobias. That is, I'm afraid of a certain thing, fear of spiders or heights, and generalized fears, or fears in certain situations. These are technical differences. The specific phobias belong to the better treatable ones, but they can also lead to a panic attack. But you can really do behavioral therapy well there. In the case of generalized anxiety disorders, where the patient often says, it's just always in that situation, so I can't make a clear trigger, then you just have to think one step further. In which environment is the patient exposed? And by that I don't mean does he have stress with the people around him, but really also physically, in what circumstances is he exposed? Maybe he got up after a move to an apartment. Did you renovate? What colors did you use? Did you buy new furniture? You have to ask yourself that now. That topic, I don't want to say avoided, but it's just like that. What do you do then? Is there a transmission mast nearby? We live in a huge wave salad with different intensities of radiation. We know that this radiation has an impact on biological systems, and there is certainly one more sensitive than the other. And before something like panic attacks, anxiety disorders, palpitations, fatigue, nausea in the head, that didn't exist before. So it must have something to do with our civilization. Even 100 years ago, you already knew that people who live in cities are more affected by these symptoms than the rural population. Schizophrenia doesn't have a so-called north-south slope, like multiple sclerosis. That means northern countries are affected differently than southern ones. But a connection that you know is, if you live in a city, you have a higher risk of getting sick from schizophrenia. That means, I also have to consider environmental factors, and we don't often have the same causes as for many other diseases. Do I have heavy metals in my brain? Do I have a virus burden? Do I have other environmental toxins in my brain? In France, Parkinson's disease is recognized as an occupational disease of farmers. Most pesticides are xenoestrogens, is known to be one of the causes for Parkinson's. And so it is also for other things. I have already healed young people with a vitamin B complex from their alleged borderline disorder. That's always the problem when someone comes from a difficult environment. I had another young patient who slipped a little into the drug scene. Sometimes they are already marked off, even with doctors or psychologists. You often don't take into account that they can also have a micronutrient deficiency. I have several patients who I can get out of with a certain micronutrient combination, sometimes even in a very short time from the so-called depression. A patient once said to my psychotherapist that she is now hypomanic. I thought, wow, okay. But she said, I finally feel like myself.
What do you mean by hypermanic? Overexposed to nutrients?
Hypermanic, i.e. manic, from mania. This rather overdue, overdone being. And the patient said, actually, I feel normal. That's what it seemed to me. And that's a phenomenon that can occur when you come out of a depression. That you make a swing in the other pole. It can take place without the influence of drugs. But it can also take place under the influence of drugs. That I shoot a bit beyond the target. Not in the normal way, but that I get a bit over it. That's hypomania. It's not really manic, but a bit too good on it. A bit too agile, thoughts a bit too fast, a bit too little sleep. Those could be symptoms.
I can't get the picture out of my head anymore. I'm just talking about it now. Also in Germany. And I'm horrified when I drive through the village in the afternoon. And I have children who walk home from school with masks on, sit on the bike with masks on. Where my heart really bleeds. And I think, how do we get them turned again? I mean, apart from the fact that the adults later what was done there. That's another thing. But what kind of experience do you have? Sometimes I think the young people also take the mask a bit, especially in puberty, to protect themselves a bit. To say, okay, I don't have to show a facial expression, I don't have to look at anyone. But with some children, especially alone on the bike, I really see the fear.
Yes. I have to say, I can't speak from a huge experience, because I live and work in Switzerland. And since the mask requirement has gone, the masks are also gone with my patients. I'm not quite sure. I think there was a phase. But when I visit Germany, I also see that and realize with the horror that even now in summer children still walk around with a mask on. And then I think, if you are afraid, then at least inform yourself how such a mask should sit. So then also ineffective. Just not sitting properly, breathing next to it. It's more of a psychological effect. I really don't know which wave is still coming to us. What I always saw with horror are babies, little children, with 3 years old, who can no longer see the facial expressions, and I think, if they are 10, if they are 20, what will come of them? Can the mirror neurons form sufficiently? At home, they will be able to see their parents. But there are so many opportunities where they can't see it. They can't see the complete face, which they learn from. Can't see it in school.
I heard from a distant friend in Germany that parents put a mask on their children at home. There were already violent actions.
There are many things that come together. The mask itself, but also to grow up in a fear environment, in an environment without complete trust.
These are the things where I say, can we make up for this?
I think it has never been to this extent. We want to stay optimistic. Children can learn very quickly, yes. But I think, at the moment it is not foreseeable what will come to us.
So it would mean, it would be important for people who know that they belong to the more labile type, who is more susceptible to anxiety and depression, that we really say, come on, I'll make a reasonable diversion of heavy metals, I'll take care of a reasonable gut flora, I'll make my micronutrients really on a level.
Ausleitung mal von Schwermetallen, ich kümmere mich eine vernünftige Darmflora, ich mache mal meine Mikronährstoffe mal wirklich auf ein Level.
Absolutely.
I mean, absolutely, it definitely makes sense, because apparently 250 years ago there was no fear disorder. So it must have something to do with environmental factors. When I was in psychiatry, a colleague always said, yes, fear makes sense, evolutionary, biological. I don't know, I thought about it for years, until I really found a few things on literature, where I said, yes, hey, I believe that now, because I think fear makes evolutionary, biological no sense. It doesn't make any sense at all if I walk through an obstacle course and am afraid. I have to be careful. I have to have respect. Even if I want to climb a mountain, I have to be able to assess the dangers. Yes, I have to be able to assess that. The colleague always says, yes, when I walk across the street, a truck comes and then I have to be afraid, because my escape reflex is activated, then I can run away. No, I can also run away if I'm not afraid. Fear makes it tight. With fear, I get a tunnel vision. With fear, I can't think clearly. With fear, I can't act well for myself. With fear, I can't necessarily follow my intuition. Intuition is also a topic on its own.
To recognize connections.
But fear blocks me. Fear doesn't allow me to unfold my full potential. If someone knows that I tend to do that, they should necessarily train good things when they are doing well. The physical is an important aspect, but also doing exercises. There are short exercises. How can I get down? How can I get down? How can I visualize that I have something like primordial trust?
Are there also a few resources from nature where you say, we've had it in other shows with, I was just about to say ayahuasca, about ashwagandha.
Ich wollte gerade Ayahuasca sagen. Mit dem roseroot.
Ashwagandha.
Exactly. No idea. You know, a build-up set where you improve the adrenal glands a bit.
Set, wo man schon mal die Nebennieren ein bisschen in die Spur bekommt und
Yes, exactly. I go into detail with questions that I say, one helped with 5 ATP, the next with ashwagandha, the third with tyrosine.
Progesterone in women?
I do it rarely. Because when I go into hormones, before I use a hormone, or a bioidentical hormone, I have everything else before. I can also take 5 ATP. The body can also make progesterone from it. Exactly. I prefer to give all the ingredients that the body can regulate and don't like to go so directly in one direction. Because then I also shift things that I may not even know how I shift them or with what consequences. And if I think progesterone is necessary, then I detox when there are hormone problems. I have the most hormone problems or hormonal irregularities due to xenoestrogens, such as glyphosate, which also leads to dysregulation. Also, mercury is a hormone disruptor. It leads to dysregulation. My wife shouldn't suffer now. But there are many other possibilities before I take these measures. Or you can take monk's pepper for progesterone, for example.
Yes, I can only confirm that. I've been dealing with hormones problems for a long time now. And now that I'm doing chelate excretions, it suddenly regulates. And before that, I had to do saliva analysis, here bioidentical.
Everyone has to do fever therapy with me.
Great, I did that too.
It regulates the hormones. And there are studies that say that fever therapy has sustainable detox effects up to cleaning the DNA level.
Reinigung der DNA-Ebene.
Wow. Is that enough?
Even if someone has depression, then I can also use it.
Is it enough if you do it once? Or do you say that hypothermia has to be done on a regular basis?
Doing hypothermia on a regular basis makes sense in one way or another. Someone who has nothing can still do it once or twice a year because it has so many good and prophylactic effects. Most studies on hypothermia and artificial fever therapy indicate a series of 6 times. A series of 6 times can last over 3 weeks.
Really, twice a week?
Yes. You don't have to do it. We don't do that very often.
But I think the first time is always the worst.
That depends. Yes, usually. But I can also separate it. The study I just mentioned with the detox effect on the DNA level lasted 6 times in 1.5 years. There are also patients who I recommend once every quarter year.
I could also imagine that all this fear and depression, all this garbage we have in our body when it goes out, you can feel it while fasting, that the psyche changes completely immediately.
Das merkt man auch beim Fasten, dass sich die Psyche komplett sofort verändert.
Yes.
What can I do or preventively? Anyone who feels like in the wrong movie and is tired, and what kind of stories you have.
Und was jetzt alles für Geschichten, ja.
Just make sure that your body is cleaned.
Dass mal der Körper gereinigt wird.
Absolutely. For me, it always goes hand in hand. But how far you can do it in your own way depends on the severity and the accompanying symptoms. I would also distinguish between tiredness, fatigue or depression, or severe depression. There are also situations where I would say that a stationary stay would be appropriate. Even if I treat biologically alternatively, be it with 5-ATP, I can increase the drive before my own emotional life is back to a normal level. This is the phase when someone is suicidal or was suicidal in the past and has the drive to do it because it affects the emotional world. When someone comes out of depression, it is often the case that the environment notices it earlier than the patient himself. The patient can say, "No, I'm not feeling better, nothing is better." How is the sleep? Can you sleep well now? Yes, I can sleep well. What is your daily routine like? Oh, you did that on your own. That didn't work the last time. Oh, yes, you really have to ask, reflect, and then you see, oh yes, it did get better, but it doesn't feel like it yet. Exactly, it doesn't feel like it yet. This feeling also causes another or distorted perception. You just have to keep an eye on it.
Yes, where can you get information when you say, "Hey, I would really take such a companion and would like to try whether hypothermia or a chelate thematic"?
In Anspruch nehmen und möchte das alles mal ausprobieren, ob eine Hypothermie oder eine Chelat-Thematik.
Sure, you can do that with us. Maybe I should also say that there are very few doctors who have this training as I have it. Psychiatrists and general physicians work biologically. I am a rarity, and of course, everyone can turn to me. We work in the beautiful Schwilbrunn in the Sonnenberg BioMedicine Center. I have to say that we are a practice operation with many therapy options. We are not a clinic in the narrow sense. We can no longer guarantee 24-hour care.
Okay, nice. But you are still there and you have this beautiful combination and live the maximum for the patients.
Einfach auch hast und lebst und für die Patienten das Maximale wirklich umsetzt.
I am
Und
looking
freue mich, wenn du
forward
bald
to seeing you
wiederkommst.
again.
Ja,
Thank
ich auch,
you.
dann bis bald.
See you soon. Dear viewers, it is very important to detox regarding the topic of anxiety and depression.
Wirklich mal den Körper zu entmüllen. Ich denke,
I learn from our
lerne
wonderful
immer wieder
guests
von
that it
unseren
is one of the
wundervollen Gästen,
decisive
dass es doch
factors.
einer der ausschlaggebenden Faktoren ist.
I hope you
Wir konnten auch
learned
einiges
something.
mitnehmen. Bedanke mich
Thank you
fürs
for
Zuschauen
watching.
und wünsche Ihnen
I
eine
wish you a
wundervolle
wonderful
Zeit.
time.
Bis bald
See
und
you
tschüss.
soon.